day everyone. By the way, I am Rochelle Sarigumba, the first presenter of Group 3. In the topics, speech and communication disorders. Communication involves encoding, transmitting, and decoding message. Communication involves, there are three listed here. So first is a message. So a message is the idea or information that the sender wants to convey. He may convey it verbally by writing or speaking, or non-verbally through gestures or body language. Whatever the form, the message should be clearly formed so that the objective is accomplished. The second is a sender who expresses the message. So, sender is the person who initiates, generates, and sends the message. He represents the source of message. The communication process begins with the sender develops an idea or message that he wants to transmit. He arranged the ideas in a manner that can be understood by the receiver. A teacher delivering a lecture in the classroom is the sender of the message. The third is a receiver who responds the message. The receiver is the person who sends or perceives or receives the sender's message. There may be just one receiver or a large number of receivers. The message must be prepared with the receiver's background in mind. So, function of communication. First is narrating. Narrating is the way of communicating through telling stories. Most often, narrating are used to recount a story or in other cases to express an opinion or give information to circumscribe a situation like past events or from the perspective of the storyteller. The second is explaining or informing. So, it provides data and information to employees so that they can make educated decisions. Requesting. Requesting, telling others what we want, making choices, telling others when we need help, controlling our environment. So, last is expressing. Expressing is to express our thoughts and feelings, whether this is love or anger, agreement or opposition. Words express our inner feelings. Language formalized code that a group of people use to communicate. The 5 dimensions of language. Phonology. Phonology rules determining how sounds can be sequenced. Morphology. Rules for the meaning of sounds. Syntax. Rules for a language. Grammar. Semantics. Rules for the meaning of words. Pragmatics. Rules for communication. Speech is the oral production of language. Speech sounds are the products of 4 related processes. Respiration. So, respiration, breathing that provides power. Phonation. Production of sounds by muscle contraction. Resonation. Sound quality shaped by truth. Articulation. Formation of recognizable speech by the mouth. So, normal development of speech and language. Most children follow a relatively predictable sequence in their acquisition of speech and language. First is birth to 6 months. The communication by smiling, crying, and babbling. 7 months to 1 year, babbling becomes differentiated. 1 to 1.6 years, they learns to say several words. 1.6 to 2 years, word sports begins. 2 to 3 years, talks in sentences, vocabulary grows. 3 years on, vocabulary grows. So, knowledge of normal language development can help determine whether a child is developing language at a slowly than normal rate or whether the child shows an abnormal pattern of language development. Communication disorders according to ASHA definition. An impairment in the ability to receive, send, process, and comprehend concepts of verbal, nonverbal, and graphic symbol systems. A communication disorders may evident in the process of hearing, language, and speech. A communication disorder may range in severity from mild to profound. And according to IDEA definition, a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affects a child's educational performance. So, what is impairment? So, impairment is abnormal speech that is unintelligible, is unpleasant, or interferes with communication. And also, speech impairments are disorders or speech sounds, fluency, or voice that interfere with communication, adversely affect performance and functioning in the educational environment, and result in the need of exceptional student education. And what is language impairment? So, it is the difficulty or inability to master the various system of rules in language, which then interferes with communication. And language impairment is defined as a disorder in one or more of the basic learning process involved in understanding or in using spoken or writing language. Language disorders can affect both spoken and written language and can also affect sign language. Typically, all forms of language will be impaired. And that's all. Thank you.
Good day everyone, I am Esreen B. Angilan, your second presenter in Group 3. My topic is all about types of speech impairments, causes of speech disorders, language disorders, and causes of language disorders. Types of speech impairments. There are 3 types of speech impairments, namely articulation disorders, fluency disorders, and voice disorders. Articulation disorder is a speech disorder involving difficulties in articulating specific type of sounds. Articulation disorder often involves substitution of one sound for another, slurring of speech, or distinct speech. In this type of disorder, a child has a trouble with articulation or saying the words correctly. It is caused by physical problems such as problems with the shape of the mouth, bones, teeth, brain, and nerve damage. Examples of articulation errors includes substituting one for another. Example, saying of wed for red, or leaving out sounds. Example, instead of banana, mahimo lang nana. Another type articulation disorder is distortion of the S sound, also known as lisp. To help learners who have this disorder, teachers practice revision daily. It is a technique in which you repeat what the learner has just said but with correct pronunciation. Avoid imitating your learner's error. Always read to your learners. Incorporate modeling into play. Narrate daily routines and practice successful words. The second type of speech impairment is fluency disorder. Fluency disorder is an interruption in the flow of speaking characterized by a typical rate, rhythm, and disfluencies. Examples of fluency disorder is repetitions of sounds, syllable words and phrases, sounds prolongations and blocks, which may also be accompanied by excessive tension, speaking avoidance, struggle behaviors, and secondary mannerism. People with fluency disorder also frequently experience psychological, emotional, social, and functional impacts as a result of their communication. There are two types of fluency disorder. One is stuttering and the second is clustering. Stuttering is the most common fluency disorder that is an interruption in the flow of speaking characterized by specific types of disfluency. Cluttering, also, is another fluency disorder and is characterized by a perceived rapid and irregular speech rate, atypical pauses, maze behaviors, pragmatic issues, decreased awareness, and fluency problems or moments of disfluency. Excessive disfluency, collapsing or omitting syllables and languages formulation issue, which result in breakdowns in speech clarity or fluency. The next is voice disorder. Voice disorder occurs when voice quality, pitch, and loudness differ or are inappropriate for an individual's age, gender, cultural background, or geographic location. A voice disorder is present when an individual expresses concern about having an abnormal voice that does not meet daily needs. The functional. Organic is a voice disorder that are physiological in nature and result from alteration in respiratory, laryngeal, or vocal tract mechanism. Functional is a voice disorder that result from improper or inefficient use of the vocal mechanism when the physical structure is normal. Example for that is vocal fatigue, muscle tension, dysophonia or aphonia, diphrophonia, and ventricular phonation. How teachers deal learners who have speech impairments. They deal with the learners who have speech impairments by the use of relaxation technique to help them speak more clearly. They need more time to answer oral questions in class or for tests. They also need sitting accommodation, such as sitting in front row. If their speech problems are related to a hearing impairment, use assistive technology to better communicate in class. Causes of speech disorder. Cleft palate. An opening or split in the roof of the mouth that occurs when the tissue doesn't fuse together during development in the womb. A cleft palate often includes a split in the upper lip, but can occur without affecting the lip. Paralysis of the speech muscles. An example of paralysis of speech muscles is dysarthria. It is a motor speech disorder in which the muscles that are used to produce speech are more damaged and produce speech paralyzed or weakened. Example of speech muscle is the tongue. If the person with dysarthria cannot control their tongue or voice box, it may slur words. It will be difficult to pronounce the words correctly. Next is the absence of teeth. The absence of teeth, premature tooth loss affects speech. It is because losing a baby tooth early, especially detrimental, since this can negatively affect the child at a critical time of language development. When this happens, it is common for a child to need help from a speech therapist later on because of the speech impediment that develop. Next is craniofacial abnormalities. Craniofacial abnormalities or anomalies are deformities that affect a child's head and facial bones. These disorders are typically present at birth and can range from mild to severe. Common craniofacial anomalies is cleft lip and cleft palate, the separation in the lip and the palate. Next, enlarged adenoids. It is located higher up in the mouth, behind the nose and roof of the mouth. It enlarges and inflames adenoids called adenoiditis that can make breathing difficult and lead to recurring respiratory infections. Adenoids trap germs that enter the body. Adenoid tissue sometimes swells of it tries to fight the infection. Also, allergies can make them get bigger. Next, if the person with dysarthria cannot control their tongue or voice box, it may slur words. It will be difficult to pronounce the words correctly. Next is the absence of teeth. The absence of teeth, premature tooth loss affects speech. It is because losing a baby tooth early, especially detrimental, since this can negatively affect the child at a critical time of language development. When this happens, it is common for a child to need help from a speech therapist later on because of the speech impediment that develop. Next is craniofacial abnormalities. Craniofacial abnormalities or anomalies are deformities that affect a child's head and facial bones. These disorders are typically present at birth and can range from mild to severe. Common craniofacial anomalies is cleft lip and cleft palate, the separation in the lip and the palate. Next, enlarged adenoids. It is located higher up in the mouth, behind the nose and roof of the mouth. It enlarged and inflamed adenoids called adenoiditis that can make breathing difficult and lead to recurring respiratory infections. Adenoids trap germs that enter the body. Adenoid tissue sometimes swell of it tries to fight the infection. Also, allergies can make them get bigger. Next is traumatic brain injury. Traumatic brain injury is a sudden damage to the brain caused by a blow or jolt to the head. Common causes includes car or motorcycles crashes, falls, sports injuries, and assaults. Injuries can range from mild concussions to severe permanent brain damage. Last is neuromuscular impairments. It includes a wide range of diseases affecting the peripheral nervous system, which consists of all the motor and sensory nerves that connect the brain and spinal cord to the rest of the body. Progressive muscle weakness is the predominant condition of these disorders. Example of neuromuscular impairments is myasthenia gravis, an autoimmune disease where immune system produces antibodies that attach themselves to the neuromuscular junction and prevent transmission of the nerve impulse to the muscle. Language disorder. Children who have difficulty understanding language have a receptive language disorder. It is clearly understandable. Also, children who have difficulty producing language have an expressive language disorder. So, causes of language disorders. Cognitive limitations or mental retardation. Mental retardation is a cognitive limitation as characterized by scores greater than 2 standard deviation below the mean on a valid intelligence quotient or IQ measure with limitation of adaptive function in communication, self-care, daily living skills at home or in the community or social skills. Second, hearing impairments occurs when there's a problem with or damage to one or more parts of the ear. Conductive hearing loss results from a problem with the outer or middle ear, including the ear canal, eardrums, or ossicles. Specifically, these hearing impairments focus in the ear problem. Number 3. Behavioral disorder. It involves a pattern of disruptive behaviors in children that last for at least 6 months and cause problems in school, home, and in social situation. Example of this behavioral disorder is paranoia, repetitive questioning, screaming, calling out, and etc. Lastly, the environmental deprivation. Deprivation refers to the unmet need due to lack of resources. So when referring to environmental deprivation, it means the absence of physical environmental conditions that can contribute to good health and well-being. So that's all my topic. Thank you.
So I am the third presenter. I will be going to discuss about identification and assessment of speech and communication disorder. Communication disorders are usually first identified by teacher observation. By doing this, you can help identify the child with a communication disorder by listening to how the child speaks and say. The key is to look for consistent differences in language use, articulation, and comprehension. So when a child consistently misspeaks by saying th for s, for example, you should recommend to the parents that the child be evaluated. So we have the speech language pathologist. They are going to provide services. So what are what are the duties for speech pathologists? Okay, they work to prevent, assess, diagnose, threat speech, language, social communication, cognitive communication, and swallowing disorders in children and adults. So that is the providing services of the speech language pathologist. So after that, the pathologist evaluate includes physical examination and testing. If they find out that your students or your um, son or daughter that they identify that your children is have this disorder. So we are now in educational approaches. Articulation errors and phonological errors. So it means that articulation is problems forming speech sounds properly, while a phonological disorder can produce the sound correctly but may use them in the wrong place. So, bali, opposite ni sila nga problem. So, ang mahimo ang ani is discrimination and having a production activities. So, daghang mga activities nga ilang ipahimo in order to kanang maanad ang ilang para ma-flow or ma-overflow na ang ilang sound nga ma-produced. Fluency disorders. So, fluency disorder, which is often referred to as stuttering, is characterized by primary, core, and secondary behaviors. Primary behaviors may include repetitions of sounds, syllables, or whole words, or prolongations of single sounds, or blocks of airflow or voicing during speech. So, ang mabuhat ani is the treatment is behavior principles and self-monitoring in order to dili bito siya kaadyo maggrabe. And the next is voice disorders. So voice disorders affect the ability to speak normally. These disorders can include uh what are this? Can include uh impairment of the voice itself, and they affect the quality, pitch, or intensity of the person's speech. So, for example, students with the voice disorders may sound hoarse all the time or speak too loudly. Okay. So, the treatment here is direct vocal rehabilitation or surgery. So, after that, we have a language disorder. So, what is language disorder? So, people with language disorder have difficulty expressing themselves and understanding what others are saying. This is unrelated to hearing problems. So, language disorder, formerly known as receptive expressive language disorder, is common in young children. So, the treatment here is exploration of expressive language, naturalistic interventions. So, augmentative and alternative communication. These are the some examples of service delivery models. So we have monitoring, pull out, collaborative consultation, which is multiple people who are getting together to share their expertise, diba? Uh, we have a classroom base. It supports any kind of strategies to enhance. And we have a self-contained classroom wherein a special education teacher is responsible for the instruction of all academic subjects. And last, we have community-based refers to have this is the active rule to highlighting the matter to them by explaining it.
Hello everyone, good day. I am Emeline De Leon and I am the fourth and last presenter of Group 3 in the topic Speech and Communication Disorders. So we will go to our PowerPoint presentation. So how teachers can make a difference. So we have 3 ways listed here. First is all peers are supportive of each other. Second, maintain eye contact with a speech impaired student during the whole conversation. Third is do not finish sentences or fill in words for the individual who stutters. So, first, all peers are supportive of each other. Support and the help of peers is important because it motivates everyone to develop self-esteem, confidence, and positive feelings. Peer support often experience an increase in their own ability to cope up with the problem. So, peer support is important. Second, maintain eye contact with a speech impaired student during the whole conversation. So, eye contact and speech are often the main developmental challenges of a child has. Eye contact is vital because it means the child that he or she is interacting and connecting with you. Also, the more a child looks at you, the more he or she will learn how to communicate. So, maintain eye contact is important also to the child. And the third one is do not finish sentences or fill in words for an individual who stutters. So, for example, a child has trouble with pronouncing certain words, or a child who stutters because he or she feels shy and scared in speaking. So, as a teacher, we should not finish what they want to say. Instead, encourage them to finish what they are trying to say. It can increase their confidence and they will feel good about it. So encourage them, do not fill in words. Do not try to finish sentences what they're trying to say. So you should encourage them. It can increase their confidence. And now we will go to the next tips for teachers. So it is the best practices. So we have 7 tips for teachers. So first is be near to the student when giving instructions, or to the learner rather. So position yourself at or below your child's eye level consistently. It is less eye strain and easier to look at you this way. Whenever the child does look at you, celebrate him or her for it. Tell them how much you appreciate them for looking at you. He or she may not know how special it is to you. So, also ask the child or the learner to repeat the instruction and prompt when necessary, in order for you as a teacher to know if the learner understand the instruction you are saying. So second, speak slowly and deliberately. Be aware of how you speak. Many people run their words together or speak without enthusiasm. So this make it harder for the child to understand what you are saying, or the child may be less motivated to listen to your words if you are not speaking with enthusiasm. So speaking with enthusiasm is important also. So the third one, provide step-by-step direction. So giving instructions one at a time in the order you want them to be carried out. You need to check and make sure that the instructions you are saying are completely understood by the child or by the learner. If not, provide any other instruction. So, or make it clearer. Make your instruction clearer until the learner will fully understand it. So we will proceed to the fourth one. Use gestures that support understanding. So, by using gestures, it draws their attention to what you are saying and draws attention to the important parts of your discussion. So by using gestures, or by having gestures, it helps the learner to better understand the instruction or your discussion. And we will proceed to the fifth one. It is about modeling correctly speech patterns. So model correct speech patterns. So if the child is struggling with certain speech sounds, it is important to model it correctly for them. So it is a good idea to direct the child's attention to your mouth when you are doing it. So for instance, if a child says fish instead of fish, so they pronounce the fish into peace. So you could say that, watch my mouth. So you should become correct the child by saying watch my mouth and try to say fish again. So the sixth one, touch base with the speech or language. So it is important to get in contact or communicate them with the speech or language. And now we will go to the seventh tips for teachers. So be patient when the child is speaking with both eye contact and speech. Enjoy yourself as you help the child. Do not rush. Just enjoy being with him or her. Since rushing may resulted, or it will definitely resulted into frustration. So the child or the learner will feel frustrated if you are rushing, if you are not patient enough to handle him or her, or to understand the learner. So we will go to the next slide, or the last slide. It is about the summary. So many of these disorders are diagnosed during childhood. Patients may struggle in academic settings and may have problems with social interaction. So many children with these disorders show dramatic improvement by adolescence. So however, people with severe communication disorders may experience ongoing challenges to their ability to function as independent adults. We all know that communication is an important aspect of life and experiences. When it comes to learning, communication plays a major role due to the fact that it allows children to participate actively. If children can't understand what they are or can't understand the words they hear, or they are struggling in expressing their ideas, so children will definitely have or experience difficulties or challenges. So it is important that we as a teacher will understand them, help them, and motivate them to keep going despite of their situation. So we as a teacher has or have a big responsibility to help the learner to cope up with the situation, to keep going despite of the situation they are experiencing. So that's it of my discussion. Thank you for listening, and I hope that you gather or you understand. Thank you.